Eric. Give it just a couple more minutes, a few more seconds to let people enter and get comfortable. It's wonderful to see you all here tonight. I see some familiar names. That's great to see you all. Thank you. We'll give it just a few more seconds. Okay, so it looks like here in the Zoom, we have a total of 63 people. I know that we equal that in the Facebook Live. It's wonderful to see everybody. We'll go ahead and get started. So hello, everyone. Welcome to this week's community update. I think most of you know by now that I'm Cindy Vosberg, Crescent City Del Norte Chamber of Commerce Director, and as always, honored to be here with you. Tonight, we'll be hearing updates from Mitch Hanna of Sutter Coast Hospital, Dr. Stutz, our Del Norte County Public Health official, and Del Norte School Superintendent Jeff Harris. I'd like to thank them for being here with us. Just as in the past meetings, after the updates, we'll have time for some questions and answers, and we'll get you all out of here by around 7 o'clock. We carried over some of the questions from last week's meeting, and we'll go ahead and take as many of the new questions as we can tonight. So the rest will carry over to the next meeting. And just remember, each week we are evaluating our community's health situation. Let's take just a moment and celebrate that the rate in our county for partially vaccinated individuals is over the 50% mark and rising. This is really going to ensure reaching that herd immunity we hear so much about. So thank you all for getting vaccinated. It's helping. And I want to stress once again the importance of us being united against the virus and not against each other. Regardless of our personal beliefs, together we are stronger than alone. So let's unite in this battle against COVID. I also want to remind everyone of the Vax to Win promotion from the Del Norte Healthcare District. This is a really cool promotion. Just enter into the contest and you can win either $500, $250, or $100. What is so cool is if we got vaccinated in the past, we can enter that portion of the drawing. And if you are newly vaccinated, you can enter for that portion. It's easy to enter, and you only have to enter once, and you're in for the entire promotion. You can enter it right at the website of covid19.dnco.org. That's covid19.dnco.org. And with that, let's turn this meeting over to Mr. Hanna with Sutter Coast Hospital. Here you go, Mitch.
Thank you, Cindy. I wanted to, I'm happy to be here this evening, and I wanted to share with you that I think we are positive signs. We actually today have 12 patients in the hospital with COVID. And if you look back a few weeks, 24. So we have half of what we had previously. And I want to thank the community and thank all of the panelists for your efforts, because I truly believe that our quick response, and when I say ours, I mean our community's quick response to what we saw as a significant health problem has contributed to that. So with that, Eric, if you would put up the first slide. So this is just sharing with you trend that we're seeing. And if you look back on, well, let's see, what was that, 8/22, we were up at 24 inpatients, and today we're at 12. And I'm heartened by the fact that, yes, this is Sutter Coast data and this is Del Norte County's data, but if we look throughout the Sutter Health footprint, we're seeing a similar downward trend. Yes, it's still more patients than we would like to see with COVID, but we're making progress. And as Cindy mentioned, hopefully as more people get vaccinated and we attain that herd immunity, we will see these numbers continue to improve. Could we have the next slide, please? So this is, you've seen this before. different numbers, of course, but this is the number of hospitalizations from August 1st. And as you can see, a large percentage of those, 86%, were unvaccinated. For those of you who may be seeing this for the first time, the torsos that are outlined in black are patients who were over 65. Those in orange are those who were unvaccinated, and those who were vaccinated. So you can see a much smaller percentage of vaccinated patients in the hospital, a much smaller percentage, 12%, requiring critical care, and only 5% requiring a ventilator. Next slide, please. Similar, this is today, and as you can see, we've got, this is showing 11. I think we had one more patient admitted. We have 12 patients in the hospital, of which 72% are unvaccinated. And again, the breakdown by critical care and by ventilator assistance. Next slide, please. So this is not a very happy slide. This is our number of hospitalized deaths. And I'm really sorry to see that there actually is one there who was vaccinated who died just in the last couple of days. I will share what we're seeing with those who are succumbing to this virus. There are typically, not always, but typically some comorbidities, other risk factors associated with their demise. Next slide. So people have asked, I think the last couple of weeks when we've held this webinar, about the number of transfers. So I wanted to share that with you. We've really had very few transfers. We've had a total of 4, and vaccinated versus unvaccinated really doesn't make a difference on this one, but interestingly, all were vaccinated. And one was transferred because of lack of beds. So that was presumably when we were at that peak back in maybe the 3rd week of August. The others were transferred for a higher level of care. So as you can see, we haven't had to transfer a huge number. And part of that is because we really tried to get ahead of the curve. We involved the California Emergency Medical Services Authority and CDPH at an early point and partnered well with our county. And again, I thank all for that. And the next slide, this is, you've seen this before. This is just a reminder that we continue to have a vaccine clinic, and you do not require an appointment for that, Monday through Saturday, 9 a.m. to 6 p.m. And that is at the Sutter Coast Community Hospital in the salmon colored building. We have drive-through testing. Again, no appointment required for that. That's same hours, well, slightly different. Drive-through testing is Monday through Saturday at 5 p.m. And then the monoclonal treatment does require an appointment, and there is a number there for all if you have any interest or need for monoclonal antibody treatment. With that, I will turn it over to Dr. Stutz.
Thanks, Mitch. And Eric, can I share my screen and put a little PowerPoint up?
Yes, you should be able to share.
All right. Stand by. So, sorry, I'm getting a little bit of a computer error here. 1 second. All right, so this is the county level data that I've been seeing over the last 2 weeks. So from 9/2 to 9/15, we had about 366 new cases. That corresponds to a sort of a CDC transmission level of high still. Although we slipped, I think we slipped just below the transmission level from high to the category just below that I think, over the last week. So we're still borderline high transmission rates according to the CDC, even though cases have sort of leveled off. The active cases that we have going on today are 175. And then the age range of all cases, I just wanted to highlight that data. You can see that you're at greatest risk if you're 18 to 49 years old of contracting a new case of COVID in this county, probably due to a number of factors, lack of vaccination, as well as that age range being the largest age range that's out and about and going to work and interacting with other individuals in the community. So the number of, so you can see that the current week that we're in right now, that's the week I don't have complete data for, but for weeks, the weeks prior that I do have complete data for, our testing positivity had gone down from 9.3 to 9.9 to 8.23%. That's great because it was up at 15, which is outrageously high, but 8.23 is still pretty high, as you recall. Back last year, they were still considering that to be a high transmission potential, high prevalence in the community. The average number of cases, new cases per day, has steadily come down over the last 3 weeks. I included this week that we're in now, even though we don't have complete data because that goes through the end of today. So we may get some more new cases by the end of the day. So that's come steadily down from about 36 to about 26. That's great, but again, that still kind of puts us in the borderline high transmission rate for our county, for the population that we have. It's still around 100 cases per 100,000 population per day, which is considered high. The number of hospital admissions per day has also come down from, you can see in weeks prior, it's been an average of 2 down to an average of 1.2. And I don't know what this week's is because I haven't seen it yet. And then the average number of ICU patients in the hospital has steadily decreased as well, from 7 to 5. I'm not sure what it is this week, but it sounds like it's down as well. The vaccination rate, we are steadily increasing at about 1% per week, roughly 1 to 2% a week. So as of last week, we're at 45.8%, and yeah, if you add, as was mentioned, as Cindy mentioned, if you add the number of partial vaccinations to the number of full vaccinated, we have broken the 50% mark. So assuming most of the people who got their initial shot are also going to get their second shot, we will break the 50% mark for our county. So that's pretty awesome. And then the COVID-related deaths, we have, that I know about in the week that we're in right now, two deaths reported. And so I wanted to point out that number from 910 to 916 may change because sometimes we have deaths out of the county or deaths that are then determined to be COVID deaths subsequently. So those are only the deaths that we know about this week so far. And that also has come down from last week. I think I may have misspoke during last week's town hall, and I think I had a number 7 for 827 to 92. That number is actually 2. The problem comes that when some of those deaths are reported to us, they may not have actually happened in the week that they're reported to us. So then we have to go investigate and find out that some of those cases actually occurred out of the county in other time frames, like in the week prior, which is usually what happens. It takes about a week to find out about those. And then you can see the age ranges of those deaths down below. So that's about all I have for the data. And I'm interested to hear what questions people have.
Thank you, Dr. Stetz. And if you can stop sharing your screen.
That would be nice. How do I do that?
So you're going to, there you go. Okay. And so, Mr. Harris?
Thank you, Cindy. So, I just kind of wanted to show people one of the biggest questions that we've been getting is in regards to contact tracing and what different scenarios look like. So I'd like to remind everyone This is our district website, dnusd.org. At this website, you can go to families. At families, you can also then click on COVID-19 information. That will take you to this screen. Now, I think it was last week, I actually showed the COVID dashboard. So as of this last Tuesday, when we update this weekly, you'll see the number of students by site, the number of staff by site. Now, one thing I really want to make clear to everyone who's joining us tonight is you may have heard of someone who's COVID positive at a school site. Let's take Best Maxwell, for instance. Right now, we have no confirmed cases of students or staff. That's because those cases haven't been confirmed. If you've heard of someone who is positive, it has not been confirmed with us. So what our grid here is showing are only confirmed cases by school for students and staff, and then at the bottom for the district as a whole. And remember too, that these numbers will change week to week, just like the county numbers will change, because we have students who are no longer confirmed cases, they drop off. And we also have students that join into this group in between the last Tuesday and the current Tuesday. So these numbers will change. We've heard, that we're manipulating numbers, that we're changing things around. Again, we're only showing verified data. If we close that down and go back over here, again, at the top of the page, those are the California Department of Public Health guidelines. I get asked a lot, is the board coming up with these guidelines? Are you coming up with these guidelines? Our principals? The California Department of Public Health has set the criteria and the standards that we have to follow this year. So these are located here. And then we also have some other materials for families. One is a checklist for parents. If you recall last year, we had families that were doing screeners before their children came to school, and we were having you turn those screeners in. Turning the screeners in is no longer required. That dropped off the CDPH guidance, but we wanted to go ahead and provide these for families. Feel free to print these up, stick them on your refrigerator. Monitor these symptoms or these circumstances, which does include a close contact at the bottom, for your child. And if any of those are true, notify their school. I think I said last week, one of the things that we were seeing that we believe may have contributed to some positive cases at school were students who were sent to school already symptomatic. And by the time we were able to have those students go to the office, check them for symptoms, notify families, we were already having to close down classes. So take a look at that checklist. We're still doing hand washing. Physical distancing is maximized. We wanted to be clear that families understood why we were or were not distancing. There's some information on face coverings. We have both the CDPH guidelines and Dr. Stutz's local health guidelines. But the interesting thing, I think, for parents right now is this box in the upper right. And this is the contact tracing. So the first one I'm going to show you is pretty busy. This is kind of our internal process for going through the close contact tracing, determining who is a close contact and what steps the district is going to be taking. Now, I just want to be clear with everybody. Again, this is not something we just said, hey, here's what we're going to do. This actually follows those CDPH guidelines that I told you were on our website. And we've also gone through these processes with public health. So it's been a very collaborative process that is in line with what the state's requiring us to do. We also have a more simplified version that, again, you can print off so that you know if you get a call that your child was unmasked and asymptomatic, what they are going to be required to do. Very simple graphic that you can take a look at and help you understand what happens to a child who's a close contact of a positive case while at school. Then if we go down here to communication protocols, we often have families who say, but I wasn't notified. These are all of the different types of notifications that we do. So as a child or a staff member either exhibits a COVID-19 symptom, is identified as a COVID positive student or staff member, or is a close contact, our principals will actually be sending out notifications, and we actually call them letter A, letter B, letter C, letter D, and you can tell they go all the way down through G. And you can see who actually gets notified, right? Here's the scenario. Here's the action that's taken both at the school and internally. And then here is who receives the communication. So that's available for folks to take a look at. And then lastly, this is really all of those smaller processes put into one large kind of procedural sheet. So you can take a look at all of those procedures. You can see what it all looks like just by clicking on this web page and really going through it. I think I may have gone over last week all of the district and site COVID plans and how we interact with your children at school, and the processes and procedures that we're putting into place to make sure that everyone stays safe are here in this box. And then down at the end of the page is the latest guidance that we've received. So if you need access to any of this, if you have questions about any of those things, again, you can get there very quickly by going to dnusd.org/family resources, or you can go to dnusd.org, click the families button, and that will bring you to a full page where then you can click the COVID-19 resource button, and it'll take you right here. That's so again, dnusd.org drops you here, families drops you here, COVID-19 will drop you here. Or you can just type dnusd.org/family resources and you're there. So now I'm having the same problem that Dr. Stutz was having. Oh, there it is. So, I think overall, the first couple of weeks were rocky. We have kind of stabilized, as we heard from Mr. Hanna, Dr. Stutz, we've stabilized with our positive case numbers. We are still having to have students quarantined and staff quarantined. In working with our public health, not our public health nurse, I'm sorry, in working with our school nurse and our school health department. At this point, we should be able to start testing our unvaccinated staff beginning the first week of October. And very shortly thereafter, we'll be able to start testing our close contact students. And we'll let families know when that rolls around too. So just know that we are moving forward on those processes as well.
Great, thank you very much, Jeff. Was there anything else that you wanted to add?
We can probably just go into questions, and then if anything pops up.
So as in weeks past, we're going to enter the rapid question and answer period. We've got a lot of questions. We have quite a few that we held over from the last 2 weeks, and I see new ones coming in. I am going to take one of the new ones right now because it's pertinent to what Dr. Stutz was talking about. So Dr. Stutz, when can the numbers for this week be available? From the slide numbers that you were showing, are those posted somewhere or those go to you?
The numbers with that were blank, like in the blank boxes.
Correct.
Yeah, so some of those numbers can be found on the website right now, but a lot of those won't be filled in until early next week when I get all the complete data through, midnight tonight, right?
Okay, all right. And so as far as folks getting those numbers, you said some of them are posted. Is it posted in the hub?
Yes.
Where would they go to find those? All right.
Yeah, in the public health hub.
Okay, great. And then another question that came in tonight is why does the COVID hub keep changing where to find the local numbers?
I wasn't aware that it was changing, and I'm not sure why.
Okay, yeah. And so I hadn't seen it change in the last few weeks either, but then I don't see everything. So, okay, we're going to go to some of the questions from last week, and I'll toggle between new ones this week and the ones from the last 2 weeks. And Dr. Stetz, we're going to start with you. So how long after having COVID can it be transmitted to others? And when is it safe to be near someone after having COVID?
Well, that's what the whole isolation and quarantine is about, right? So, generally speaking, if you have an assumed case but not diagnosed, like you didn't get a test, but maybe you were symptomatic or maybe you were exposed to somebody, we tell you to quarantine for 14 days, right? Or if you had a known positive case, we tell you to isolate for 10, right? So it's 10 to 14 days basically, and we're assuming that most people in the community, they're not going to transmit it to somebody else after that period of time. I mean, yeah, there have been some rare cases where people have developed symptoms much later and transmitted it to other people much later than that. But on average, it's 10 days, from the start of your symptoms.
Great, thank you so much. So Dr. Stetz, can you get COVID from being served food from a COVID positive person using takeout?
Well, takeout is pretty low risk. I mean, yeah, you could get it if you somehow were exposed to them for a long period of time without masks, via aerosol transmission, right? But we used to think that there was, early on in the pandemic, we were really worried about, cleaning surfaces and washing our hands, and of course, we're still worried about that kind of stuff, and it probably still can transmit in a limited fashion in that way. But for the most part, it's transmitted, person to person through aerosol transmission. It's not usually by contact. Some bacteria and viruses do transmit very easily via physical contact. This one just doesn't happen to very often. So you would really be wanting to wear masks and stuff, obviously, when you interact with anyone from the public.
Okay, that makes wearing the mask even that much more important. Thank you so much. So Mr. Hanna, can someone with direct exposure to COVID but no positive test yet be eligible for a monoclonal, especially if they are elderly?
Yes, they can. And I would encourage them to call that number that was on that last slide. It's 707-464-8954, where a personal clinical assessment will occur. And it's just really going to depend on the individual circumstances, how close was the contact, what are their risk factors, et cetera. So I would encourage them to call.
Great, thank you so much. And so a follow-up question on that. And so who pays for that, for the monoclonal treatment?
If they have insurance, presumably their insurance. If they don't have insurance, typically we would be writing that off. So it would be treated as charity care.
All righty.
I don't want people not to access services because they're worried about the cost of care.
Thank you. Mr. Harris, who will mandate the mask wearing at sports events?
Well, so currently, and I think Dr. Stutz had said this a while back, the mask wearing at sporting events, outdoors, if you can't maintain 6 feet, at large events, the mask wearing is part of the mandate. But we are not going to be, I think, confronting people. We're not going to be ejecting people from sporting events outdoors for not wearing the masks. But one thing we may have to do is CIF is recommending, and has not mandated, but is recommending that we limit the number of people into outdoor sporting events to families only. And I don't want to go there because I want our community to be able to enjoy our athletics. However, if we do have a large number of people who are refusing to wear masks, if we do continue to have high case rates, especially amongst our students, that may be something that we have to do. But I just want to remind folks too, if they don't want to wear a mask, we have invested in extremely high quality live streaming services that you can watch from the comfort of your own home. Football, basketball, volleyball, baseball, softball, and we're in the process of putting in cameras for soccer. So if you don't want to wear a mask, there are great places where it's a lot safer to do it than at a packed outdoor sporting event. Indoors, California Department of Public Health mandates that everyone indoors wears a mask. And for the safety of our staff and students, we will be requiring that, and we may ask people to leave indoor events.
So I guess the bottom line on that is, if you're going to attend the in-person indoor sports, please wear a mask and don't put staff and volunteers in a situation where they have to approach you and ask you to leave or ask you to put it on. We all have to mandate ourselves and make sure that we're following the rules to keep each other safe. So, as
Absolutely.
Blake said a couple meetings ago. Thank you. Okay, so Dr. Stutz, where can someone get the rapid tests versus the ones that take longer? And are rapid tests as accurate as the other tests?
It depends on which rapid tests you're talking about. Rapid tests are available if you're in the hospital and you're in the emergency department. We use very accurate rapid PCR tests to determine if you have COVID, if that's contributing to why you came to the emergency department. If you're on,
okay, and I think this person was also referencing the drive-through testing, asking if they can get rapid tests at the drive-through testing.
I'm actually not sure what the drive-through testing is doing.
I do not believe so.
And either my internet connection is unstable or Dr. Stutz is.
Sorry about
Cindy,
that.
I do not believe that the
Okay, all right. Okay, we're gonna go on to the next question, which is, Dr. Hannah, has the issue with the state mandating your employees be vaccinated by the end of this month or lose their jobs changed any?
Well, first of all, I appreciate the promotion, but I'm not a doctor.
Oh,
But no, it has not changed, and we are continuing to diligently work with our staff to ensure that they are either vaccinated or they have completed one of the exception requests for religious basis or medical basis. So we are working closely with them, and right now we've got about 15% who still have not finished. So we would hate to see a termination of employment because of that.
so that's actually, so you said 15%, not 50%, right?
No, 15%.
15, okay, well,
Yeah.
that's encouraging. That's very encouraging. So Mr. Harris, if someone has been exposed, a student at school, and vaccinated with no symptoms, can they continue to come to school and not isolate?
If a student has been exposed at school, they're vaccinated, they're asymptomatic, and they were masked at the time of exposure, they can continue to come to school. They do not have to isolate. And the same is in effect for a student who has had COVID and is within a 90-day window of their recovery.
Okay, great. Thank you so much. Dr. Stutz, can we test for antibodies and where?
Yeah, I mean, any doctor's office and any doctor in the hospital can test you for COVID antibodies. There are special tests that they can send to the laboratory. The question is, what would you be interested in the antibody test for? I suppose it's to know if you had been exposed or if you'd had COVID and didn't know it prior. The only thing is that's only one measure of whether or not you were prior exposed to COVID. Those antibodies may disappear over time, and maybe you got exposed to COVID in last December, and now those antibodies have sort of disappeared in your bloodstream. There are other measures of whether or not you got exposed prior, such as memory T cells, memory B cells, and stuff like that. There are tests for those too, but they're very expensive and kind of unnecessary. I mean, it depends on why you're interested in getting an antibody test. But yeah, those tests are widely available. They're just not very useful for physicians to make decisions.
All right, great. We're going to go ahead and stay with you, Dr. Stutz. So why is vaccination better than natural immunity, natural antibodies, or is it?
So it's not necessarily better. It's not necessarily worse. We do know, because there's limited data coming out where they're comparing groups of people who've had COVID and then had a vaccination on top of their previous history of COVID. We do know that the best possible protection is when you've had COVID and you've had an antibody, and you've had a vaccine on top of that. That gives you the best possible protection.
So I seem to have lost Dr. Stutz. Oh, there we go.
Sorry about that. My internet connection is not cooperating today. But to summarize, the best protection is you've had COVID and you've got your vaccine. So they're not necessarily better or worse than one another.
Thank you so much. So Mr. Harris, this one is for you. Should we have our children wear N95 masks as they return to school?
N95 are not recommended by CDC or CDPH. It's a cloth face covering, a multi-ply cloth face covering. We are providing N95 masks for unvaccinated staff, but that's under the Cal OSHA requirements, not for children. And Dr. Stutz could probably speak to that too. I don't think that is a universal recommendation, and I don't think it's necessary.
Yeah, I would back you up there too, Jeff, and say that N95s are really only useful when they're well fit on people without facial hair. Otherwise, they're no better than a standard surgical mask. They're better than a cloth mask, but they're no better than a surgical mask if you haven't gone through an actual fit test and if it's not well fitted.
All right, great. Thank you so much. So, Mr. Hanna, how are you keeping people who come in the ER with COVID symptoms from infecting your other patients or visitors?
Well, of course, we're requiring that anybody entering the hospital be masked and be socially distanced. We're also trying to ensure that anybody entering the hospital is screened with a health screen to ensure that they're not symptomatic. And of course, we are limiting visitors to the hospital. So all of that, coupled with the fact that all of our staff are masked, all of our staff are completing a health screen every morning before they come into work, are the means we're using to ensure our patients' safety.
Thank you so much. And Mr. Hanna, I'm going to stay with you for a moment. So this question is, if my family member is in the hospital for non-COVID illness, can I still visit them?
So unfortunately, currently, no. And I will share with you, out of an abundance of caution, when we saw our numbers really starting to spike, we closed the hospital to visitors overall. So not just COVID patient visitors, but non-COVID. Now that we're starting to see those numbers come down, we are revisiting the standard Sutter protocol, which would allow visitors for non-COVID patients. A certain number based upon the reason that the patient is in the hospital per day. So I'm hopeful that we can reestablish that very soon. We know and we believe that the ability to have visitors definitely impacts a patient's ability to get well. And so we want to allow visitors. We did not take it lightly to close the hospital to visit.
Right, that's wonderful. And so, Mr. Hanna, when you make that decision and know that time, will you announce that to our local media and push that out so that everybody will know that?
We certainly will.
Okay, that's wonderful. Okay, Dr. Stutz, the vaccines are now requiring a booster after 8 months. How was this determined when it's been approximately 8 months since the rollout? What data is being referenced?
So they're not required. They're the various manufacturers are recommending them based on data that they've been collecting in their phase 4 trials, right? So after the vaccines are approved by the FDA, they enter into phase 4 of the FDA approval process, which lasts indefinitely. It's continuing to gather data forever on how well these vaccines work or don't work and what the risks and benefits are, et cetera. So there has been some data that in subsequent testing of people who received their vaccine early on, like back in December or even earlier. So they took some of their test subjects who got it the year prior, right, when they were in the process of developing the vaccines, and they measured how often they got COVID subsequently without having a booster shot, and then they compared that to individuals who just recently got their shots, like last week or a couple of months ago, and they found that there was a decrease in efficacy for the same variant of COVID in those two populations of people. So it suggests that you get better coverage if you've had your vaccine within the last 6 to 8 months, right? And so that implies that maybe a booster might be necessary or encouraged or recommended. And of course, they're looking for FDA approval for this. I think that's probably going to be the case. It probably is a good idea to get a booster, just like we get booster shots of influenza every year to cover different variants, just like we get booster shots every 10 years for tetanus and diphtheria, right? So there are many, many illnesses that we're supposed to get booster shots for during our lifetimes, pneumococcal disease, and meningitis if you're at risk, that sort of thing. So I'm not surprised by the recommendation. I think it's probably going to be the case that we probably need to have one every year.
Right, and we always knew that was a possibility. They always talked about that, so I don't think anybody should be surprised. So Dr. Stetz, we're going to stay with you for the next couple of questions. So this one goes back to masking. Is double masking with a surgical mask under a cloth mask the best way to protect both oneself and others? If not, what is?
Well, I mean, yeah, obviously the more masks you slap on your face, the better protection you're going to have for everybody, but you can't tolerate that much stuff on your face. You don't tolerate so much things in front of your nose and mouth, right? So, you know, the best protection is to wear whatever mask you have available. I would prefer surgical masks, you know, because they're made in a way that they electrostatically attract respiratory droplets and viral particles and bacterial particles. So they don't just filter the air that you're breathing, they actually electrostatically attract the germs to them, right? They're also disposable, so that once they're used, you throw them away. They're the easiest, they're cheap. That's what I would recommend. And then just, you know, social distancing and getting your vaccine, that's the best way, right? All those three things.
Right, okay. So Dr. Stetz, this is a little bit of a tongue twister. So if you have had COVID and are vaccinated, could you be a carrier of COVID and give it to the unvaccinated?
Yeah, so we know that people who've been vaccinated prior and never had COVID, or even people who've had COVID and been vaccinated and then subsequently got COVID again, you know, those people were able to contract COVID, you know, even despite their immunity. Probably a different variant. And we know that they don't generally get as sick, but they do carry live COVID in their respiratory passages, and they probably can give it to other people. And everybody who, you know, was against vaccination and masking and all these mandates and stuff latched onto that one study and said, look, you know, vaccination doesn't protect other people, it only protects you, and blah, blah, blah. Well, that's not true, because that study didn't really measure for how long the viral particles were live in people's respiratory passages. It's probably for a shorter period of time. It also didn't really do anything to measure the infectivity of the virus, the live virus that was found on those people who had been vaccinated. They didn't really see how infective it was. They just counted viral particles. I mean, we don't know how infective they were. So more studies are really needed to find out how transmissible the virus is when it's in the nasal passages of a person who's been vaccinated or who's had COVID before. We just don't really know. Right? The long of the short is that it's probably going to show, the data is probably going to show that, yeah, you can give it to other people, but for a shorter period of time, and it's probably less infective. That's my guess.
Okay, great. So, you know, we've got quite a few new questions coming in, but I have just a few left over from the last 2 weeks that I'd like to get through. And so we're going to go ahead and Dr. Hanna, I'm so sorry, Mr. Hanna, I keep wanting to promote you. How long does the typical person stay in the hospital with COVID?
So there really is not a kind of a typical COVID patient. In general, COVID patients have a significantly higher length of stay than patients who are there for other reasons. So when we have these high incidences of COVID in the hospital, we see a much higher length of stay on average.
All right. And Mr. Harris, do parents get to know if their child's teacher is vaccinated?
No. While vaccination status is not covered under HIPAA, it is covered under employer-employee confidentiality laws. What I can tell you is at this point, we have 107 out of approximately 190 teachers who are vaccinated. That's about, was that 56%? And about 31% of our classified employees are currently vaccinated. So the numbers are lower than we would have anticipated, but that's where we are right now. But we cannot share individual teacher vaccination status.
All right, thank you. Okay, so Dr. Stetz, if a person is a Del Norte resident but gets vaccinated by their doctor who's not located in Del Norte County, does their vax count for Del Norte County, or is it in the county they received the vaccination?
So when the paperwork is filled out to be submitted to the state database, it has their home address on it. So it goes on our numbers for vaccinations.
Okay.
Just
great.
like if they died of COVID and they became a COVID number, on our numbers, it depends on their home address.
And so, Dr. Stett, staying with you is another question, which is, will probation officers bring masks to juvenile hall?
They probably should, but I don't know the answer to what's happening at juvenile hall. They probably should.
All righty. And Dr. Stets, when will vax passports be available for Del Norte?
I guess it would depend on what vax passports means, what the definition is. So I don't really know what that means. You get a card when you get your vaccination as proof of your vaccination, and that's usually all that's required. If somebody's asking you to demonstrate proof of your vaccination, you should keep that card with you, and you should take a photo of it with your cell phone for sure.
Thank you. So, Mr. Hanna, what kind of treatment is Sutter giving to their COVID patients, and are they able to eat a normal diet?
Wow. Well, it depends on the patient. There's not like a standard treatment for patients, and it's really determined by the patient's physician and the patient or the patient's decision maker. And with respect to diet, again, it's going to depend on their health status. If they're on a ventilator, obviously they're not going to be eating a regular meal. So it's just entirely going to depend on the patient and what their comorbidities are, what their diagnoses indicate, what their vital signs and test results show us. And Sydney, while I'm speaking, you had asked here about number of tests occurring. I can just give you the figure for our drive-through testing clinic. It's 700 a week, roughly.
700 a week.
Now, that doesn't include everywhere else within the county that's available for testing, but at least that gives you an indication of one location.
Right. Yeah. One of the questions that have come in tonight is how many people are getting tested? Is the weekly average staying constant? And so that 700 just through the Sutter Coast drive-through, but we've got the other testing sites and the pharmacies. And I think that's on the hub, isn't it, Dr. Stets?
I don't know that it is on the hub, but I can actually give you the numbers right here for a couple of weeks prior. So from 9/3 to 9/9, September 3rd to September 9th, we had a total of 1,603 tests. And for the week prior, it was about 1,800. So the number of total tests being performed is decreasing.
Mm-hmm. All right, great. It's still healthy though, right? So Dr. Stets, one more question here for you, which is, when will the president's new mandate of either vaccines or weekly testing for businesses with 100 employees go into effect here?
Yeah, I don't think anybody knows the answer to that question. We were just talking about that amongst the health officers and the RDM, MHS, and Cal OES crew. Nobody really knows the answer to when those mandates or whatever they are might come into play.
Thank you. And Dr. Stets, I have a couple more questions that I want to fire at you. One is, a person gets COVID, gets vaccinated, gets COVID again, has a monoclonal antibody treatment. Is the person still contagious, and should they quarantine?
Well, so they get COVID, they get vaccinated, they get COVID again,
Mm-hmm.
and then they get a monoclonal. Yeah, it's hard to say what the timeline is on that. I mean, I would go back to the 10 to 14 days again. So it's from 10 days from your, from your onset of symptoms or from your positive test, right? And that's it. So none of the other stuff really matters. All it matters is when were you COVID positive, and did you do your appropriate isolation or quarantine? So.
Thank you. So, Mr. Harris, when a child is on quarantine due to exposure at school and they have to get a negative test before they can return to school, does the test have to be performed by the school district, or can the test be obtained from another source?
No, so what we're asking is that the family get the test from a trained source. So I know that we have some people that are going up to, I believe it's St. Timothy's up in Brookings, or they're going to Sutter, or their own healthcare provider, that's fine. What we're not accepting at this point are home tests or word of mouth verifications. So they do have to be verified from a trained testing provider.
Thank you. So Dr. Stetz, I have one more here for you from that was submitted earlier, but I think you've already answered it. And so it makes perfect sense of what you said earlier about the surgical mask. This question was, if COVID particles are smaller than fire smoke and a regular mask won't stop fire smoke, how does a regular mask stop COVID? And by regular mask, I think they, when you answered about the surgical mask, that it collects particles.
Yeah.
But this question goes on to say, does it have to be an N95 to protect you?
Right. So no, it doesn't have to be an N95. So I actually put a link in the chat box that maybe we can send out to anyone who wants it. It's a roughly 20-page journal article that really does a great job of explaining the physics behind how different masks work and why they protect you. It's not just a simple matter of the particle is bigger or smaller than the opening. It's not like a chain link fence and bees flying through a chain link fence, right?
Mhm.
It's like there's an electrostatic action that happens when you sneeze or cough. You get a lot of particles coming out. Some of those particles are, small fomites, and they can be as small as like 5 microns, right? With one viral particle in them. And if the spacing between the fibers is 20 microns, well, yeah, how does it block a 5 micron particle? Well, the answer is there are physical electrostatic forces at play. The polypropylene that the masks are made out of, they're designed to be splash resistant on the front and repel moisture. On the inside, they're designed to absorb moisture. And then there's a third layer in the middle that is designed to electrostatically trap particles that pass through it. So it's not just it's not like filtering out spaghetti, water out of spaghetti in your sink. It doesn't work like that.
Great, that's great information. I think that explains a lot to all of us. Okay, so we're going to, let me double check this list here. I think we're going to go ahead and jump over to some of the questions, back to the questions that are coming in tonight. And it's now just about 6:53, so we'll do about another 8 minutes of questions, and anything that we don't get to, folks, we will hold over for the next meeting, okay? So this one is, this is for Dr. Stetz. Are businesses mandated for their employees to wear masks? And are businesses under the highly recommended category, but not mandated?
So right now in Del Norte, there's a mask mandate in place. So, you're mandated to wear your mask indoors in a business.
Thank you.
All businesses.
All businesses, right. Okay, so Mr. Hanna, this is for you. If someone is admitted to Sutter with COVID, does their own doctor provide care or the doctor in charge?
The doctor in charge, typically. We have hospitalists who are there 24/7 who follow our inpatients. That's regardless of diagnosis, whether they're a COVID patient or otherwise.
All right, thank you. I'm not quite sure who can answer this question. It concerns the county jail, so it could be Dr. Stetz. It may be Neil, Mr. Lopez, but is the county jail still releasing inmates to the streets with COVID?
I don't have a direct answer for that, but I could tell you that when somebody is released from the jail and they have COVID, we get notified about their COVID status so that we can follow up with that person.
All right, thank you. So this question came in tonight, which is, how old does a child need to be to get vaccinated?
So the Pfizer is approved for 12 and over, I think. I don't think Moderna is approved that young yet, and neither is Johnson & Johnson, but they will shortly be. So that's the answer. It's 12.
Okay.
It's essentially 12 and over. And we're waiting on data for ages 5 to 11. So that should come hopefully by the end of the year.
Thank you very much. Dr. Stetz, we're going to stay with you. So this question is why COVID-19 is more serious than the flu. There were so many flu cases every year and people died. For some strange reason, the flu disappears. It doesn't make sense and I'm confused.
Well, that's a great question, and I love that somebody asked that question. So, yeah, the flu versus COVID thing is so interesting from last year, and I could talk for a long time about it, but I'm gonna try not to. So, normally in a given year, we have thousands and thousands of flu cases, and I like to reference the pediatric data. So, normally in a flu season, we would get somewhere around 600 pediatric deaths from influenza, from the flu, right? And last year, during all the COVID lockdowns and everything, we got like under 10. It was a tiny amount. It was a minuscule amount compared to how we normally do. And every hospital system noted a huge decline in the rates of influenza across the country. And that was not because we were not looking for it. We were doing the testing. We just weren't finding it. We were like, I think in Del Norte, I think I didn't see a single case last year. I've never in my whole career gone through a flu season without seeing a flu show up in the emergency department. It was crazy. And so that really speaks to how effective some of those measures were, the masking, the social distancing, all the lockdowns and all that terrible stuff that we did, the washing of our hands. That's why we didn't see flu last year. Now, if you use that and you translate that to were all those tactics that we used effective for COVID? Well, if we've had 600,000 deaths from COVID and we only had a handful of deaths from influenza last year, how bad do you think COVID would have been if we hadn't done all those lockdowns and masking and social distancing and all that stuff? It probably would have been a lot worse. So that is the biggest proof that those measures were warranted at that time. I think we prevented a lot of death from COVID. I mean, COVID is a lot more transmissible, and I will tell you, it is generally a lot more deadly than most of the variants of influenza that I've come across in my career, even though I've come across some really deadly variants of influenza and seen some young people in their 20s and 30s die of influenza. I've never seen so many young, healthy people die of a virus than COVID. And you're just going to have to take a physician's word if you don't believe the numbers. And it's a real thing that I can pick out on a chest X-ray now. Seen so many cases of COVID, I can look across the room, look at a chest X-ray, and tell you that person has COVID. We're going to get a positive COVID test on them. It's a unique entity that you can actually see with your own eyes. So
wow. So thank you. That's fascinating. So we're going to do one more question, and this one comes up every week. And I don't know if you'll have an update, Dr. Stutz, on it or not, but they want to know if there's any new available information for the boosters on when we'll be receiving them, who will be eligible for them, and where the supply is going to come from.
Yeah, so the FDA is deciding like right now, do they really want to approve this, recommend it, et cetera. And I think they're hesitant because the data really hasn't been published, hasn't been peer reviewed. We're waiting for more data. I know that if you're immunocompromised right now, and there's a list of conditions that it is recommended that you have a booster, and I would recommend getting a booster if you're immunocompromised and you meet that definition. I think it's going to be a good idea to get the booster shot.
Oh, I think my internet connection may be unstable.
It's me. Sorry, guys. So to
Okay.
continue,
It's
yeah,
okay.
I would recommend it if you meet the criteria.
Uh-huh.
When it's going to be widely available for the general public, which I think the general public probably should have some, at least a yearly COVID shot. I think that's what the data is going to show. When that's going to be available, hard to say. And where that supply is going to come from, public health departments all over the states and the country are wondering that if that becomes a recommendation that everybody needs to get a booster shot, then we're trying to figure out where this is going to come from. And it's a real issue.
Thank you so much, Dr. Stutz. Would any of our panelists have anything that they would like to add to tonight's session? It's just now 7 o'clock. And it seems that our internet connection is unstable again. So I'd like to thank all of our panelists for being here. It's such an honor to be with you. Mr. Weir, did you have anything that you wanted to add?
No, just like you say, a sincere thank you to the panelists and for everyone that has shown up tonight and has partaken in these. It's great to get the data out there, and then we can take the actions we need to as a community.
So I have to say for the first time that we're not ending the meeting with a couple screens full of many, many questions. So that's encouraging. And I think it's really encouraging to see that although we're still in a community at risk, that our numbers seem to be leveling out, and hopefully the deaths are going to stop or level down to a minimal. And it's wonderful to see you all here again tonight. So we will again assess the community health over the weekend, and let's hope the numbers are low enough that we can start not having to see you every week. So thank you all very much.